Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And I'm pleased today to be joined by Jason Gagnon. Jason, great to have you here.
Great to be here.
Jason is the manager of outpatient physical and occupational therapy.
Yes, I am.
All right, so we're standing inside the Albany Med Fitness Gym. We're going to talk about this in a bit, but before we get here, let's go back a little bit.
Okay.
Tell me about your background.
So I'm a physical therapist by training. Started over on the inpatient side 22 years ago. Spent a couple of years there, but for the last 20 years, I've been over on the outpatient side of things.
So you've been here at Albany Med almost 25 years.
Almost, yeah.
And most recently focusing, as you said, on the outpatient side.
Yeah.
We're talking about 99 Delaware Avenue.
Right, yep. We started at 618 Central, but we moved to 99 Delaware about 7 years ago.
And I think many people who've been out there know that's a beautiful place. In fact, I have family members who've been there. They rave about the equipment, the staff, and the services there. Take me inside that building. Tell me what that looks like, and tell me what type of services you provide there.
Yeah, so building's beautiful. I think it's the nicest building in Del Mar, but inside of that building, we have about 12,000 square feet of physical therapy space. We have 25 full-time physical and occupational therapists as well. So we have two clinics. We have an occupational therapy clinic and then a bigger physical therapy clinic. We've grown substantially over the years with a lot of support from administration, and we've really grown to have a lot of different specialties within the physical therapy realm. So we have pelvic care, we have neurologic care, we have the most amount of board certified therapists in the region, and really the largest outpatient centered single clinic in the Capital District.
Let's talk about what it means to be a physical therapist, occupational therapist. I know a lot of people are interested in that line of work. It's the type of thing that I think is very satisfaction from that job that comes with working directly with patients. How does one become a physical therapist or an occupational therapist?
Yeah, I mean, there's a number of routes. A lot of folks will get their undergrad degree in bio or kinesiology or something like that, and then they'll go on. Physical therapy is a doctorate program now for pretty much for 99% of campuses. You can still get your master's. Occupational therapy is master's based, but you can continue to go on and get your doctorate as well.
I've been in there getting physical therapy myself in the past with my knee. You get to meet the therapist, you work closely with them. Yeah. There's a certain bonding that occurs between provider and patient in those situations. Am I right?
Yeah, and I mean that's one of the reasons I got into physical therapy, just because we can spend more time with our patients. So we have the opportunity. We're going to see you for 8 to 12 visits over the course of 4 to 6 weeks if recovery goes well. Sometimes even more with our neurologic patients. So you get to know families, you get to know the person, and you build that rapport and that trust, and then you get to see patients getting better, getting back to their life goals. So yeah, it's really rewarding.
A lot of the people that go into it seem to come from a sports background, right? Because a lot of people get injuries. Did you have a sports background yourself?
Yeah, I did. I injured my knee playing soccer in high school. I had some PT. But before that, my grandfather had a stroke when I was probably 8 or 10. So I spent a good part of my summer going to rehab with my grandmother and seeing him recover. So when I was considering a career in high school, I enjoyed the sports piece, but I really loved the recovery piece. So that's what made me want to move into PT.
You've mentioned a couple different types of situations where someone might need to come and get therapy. We've talked about strokes, obviously, individuals who have undergone some sort of trauma, even elective procedures. What are some of the other areas where people might find themselves needing the professional expertise of a physical or occupational therapist?
So one program that has grown substantially is our pelvic program. So our women's and men's pelvic health program. A lot of folks don't associate physical therapy with pelvic therapy, but it's growing. We actually have 5 therapists doing that now, and we're actually expanding our clinic to make some more space for more physical therapists that practice pelvic health. And it's been a really rewarding and growing program. We have the most amount of pelvic physical therapists in all of upstate New York, and really even in the Northeast. Having 5 in one area is a luxury. And so it's been a great program.
Well, it's a special program. Everything you guys do in that outpatient space is something that is truly value added. Like I said, I have many friends and family that have used those services. I have myself as well. I think most people listening probably know somebody who's been out there, and it's a very important part of our mission. Now we're inside the gym. Why are we standing inside the gym? What's the connection between the two and you?
Yeah, great. So about 12 years ago, I think administration had a vision to add a fitness facility, a large kind of full-time fitness facility. So we were asked kind of just the idea of rehab and physical therapy kind of go together and working out and wellness. So we started managing that 12 years ago. We opened in 2011. I think we had about 800 members, and today we average about 4,000 accesses or 4,000 folks coming to work out per month.
Per month?
Yeah, per month. Yeah.
That's incredible. Yeah. There's a couple things that we've done over the last few years to encourage people to use the gym.
Yeah.
The two in particular that I always make mention of when I do my new employee orientation every week is, first of all, it's open 24 hours a day. How does somebody access the gym 24 hours a day?
Yeah, so 24-hour access is you automatically get access when you become an employee here, but for 24-hour access you need to sign basically just a waiver form, and you fax that over to security, and usually that day you have access. You can come 24 hours a day. We're staffed here from 6 a.m. to 7 p.m., so there's always a trainer here to help you, but after hours we have pagers that you can take if you're working out by yourself and just for safety purposes, but right now about 30% of our members access after hours.
And they would get in with their ID badge, obviously.
Just swipe your ID badge. Swipe your ID badge at the elevator if it's after hours, and then to get in the fitness center on the 8th floor.
Right. And how much does it cost an Albany Med employee to be a member of the gym?
A whopping $0.
Free.
$0 per month.
I think it's the best deal in Albany.
Yeah, absolutely.
If you look around this gym, and I'm sure we'll show in the video the inside of the gym, it really has spectacular equipment. It has free weights.
Yeah.
It has all sorts of exercise bicycles, treadmills, everything you would expect in a gym. And quite frankly, it's very spacious as well.
Yeah, 10,000 square feet, state-of-the-art equipment. Over the 12 years, administration has supported us. We've had 3 different versions of new equipment, and we have full-time trainers here that are basically here to help you with whatever your wellness goals are.
So let's talk about those trainers. Let's give a shout out to them because obviously they provide an expertise themselves.
Yep.
There's classes that are offered. Talk about the trainers, talk about the classes.
Yeah, so we have 2 full-time fitness assistants, Earl and Nadine. Both have great strengths and they complement each other well. We offer, really one of our biggest classes is spin. So we have about 8 spin bikes. Nadine and Earl will lead classes in spin, so that's a big thing. I think you've done a little bit of spin too. In addition to that, we have different classes. We try to run them for access, usually kind of right after work, so 4:30, 5 o'clock classes. We try to add in a lunchtime workout, doing a HIIT or upper extremity arms workout, lower extremity workouts. So class size is small because we do have a limited space, but 6 to 8 folks can work out in a class, and usually they're pretty well attended.
So for those that don't know, HIIT is high intensity interval training, kind of intense stuff with short periods of rest, and then they do it again. Very, very challenging, but very rewarding workout.
Yeah, and if you're not kind of ready to join that, we always have listed a circuit of the day, so you can come in and look at those 5 exercises and do them at your own pace and kind of build up your endurance, and then you can join one of the HIIT classes.
Certainly one of the best views in Albany as well. We're on the 8th floor of 50 New Scotland. I know a lot of people like to work out here before their shift, maybe after their shift. What about locker rooms, or need to take a shower either before a shift, after a shift?
Yeah, so we have male and female locker rooms. We have showers in each room. We have lockers you can put your gear in. So yeah, a lot of folks early in the morning will take advantage of that. The view is beautiful. I mean, if you're not a fitness center member and you want to come up and just check out the view, I think you'll stay because you can jump right on a treadmill and walk and burn some calories and take in a beautiful view.
So it's that time of year. Everybody makes New Year's resolutions, right? We know that a lot of people want to get into fitness more. This is certainly something that we would encourage every employee to consider. Again, access 24/7. By the way, one thing about the 24/7, we have cameras in here, correct? So it's safe and it's something that security comes through periodically and checks. So if anyone's ever thinking about after hours, it's still a safe environment.
Super safe. So that's one of the things we added when we went 24 hours is cameras in here, so security can monitor that. And like I said earlier, we have the pagers, so you can take a pager if you're feeling like there's no one in here and you want some help. You'd hit that pager if you were having any type of event. So yeah, we tried to make it as safe and as welcoming and comforting as it can be.
And you mentioned Earl and Nadine. We got to give another shout out to them as well. They do a wonderful job with the classes. I know they do personal training as well, right? They help people set up and figure out what's right for them.
Yeah, so they both have great strengths. Earl is focused on strength training. Nadine is a little bit more into the cardio realm, but they complement each other well. And whatever your goals are, both of them are well equipped to help you. We will set you up on a program.
Right.
We'll take some baseline measurements.
Right.
They'll be happy to measure you a couple weeks down the road to see some of the progress you're making. And then they're always here if you have questions, right? So you're not sure you're doing an exercise right. You want to look at your form. They're here for that. Yeah.
Right. Well, it's a wonderful program. We've been looking forward to highlighting this, and this is the perfect time of the year to do it. Obviously, as we roll into the new year, and it's incredible to hear that 4,000 accesses a month.
Yep.
But I bet that as more people hear about this, they're going to come over and take part in Albany Med Fitness as well.
Yeah. So. Yeah. I hope they do. I think we're probably one of the few corporate facilities left that has free access to a great program here, and wellness is really an initiative that we really want our staff to take in and to be a part of, and so we're here for you, whatever your needs are. Yeah.
Jason, I guess we'll end by saying thank you so much for everything you do and your team does out there at Delaware, as well as the incredible work you do right here at Albany Med Fitness. Thank you so much.
Thank you.